Hello, my name is Jim Groff, and I am doing a case study on eye diseases. For my case study, I have a lady named Karen, and she is a 64-year-old white female. Her medical history includes hypertension and type 2 diabetes. She has a body mass index of 30.2, which makes her obese. She's a pack-a-day smoker for the past 20 years. She presented to the ER with complaints of blurry vision and eye pain. The ER gave her a disposition to go to the nearest ophthalmic specialty hospital. And for the condition that I'm going to present on, Karen has several risk factors. Those risk factors include hypertension and diabetes, her history of smoking, that she's white, her age, and the obesity. So what is Karen's diagnosis? What they determined at the specialty hospital is that Karen has macular degeneration, and it's further specified with the terms it's intermediate, age-related, and exudative. Age-related, due to Karen's age. It's in the intermediate stage with her symptomology beginning with the sudden blurry vision. If she was in the early stage, she wouldn't have symptoms, you would just see the blood vessels starting to change. It's exudative or wet because of that there's fluid buildup and accumulation happening in the retinal spaces. So what is macular degeneration? Macular degeneration is a loss of retinal integrity in the area at the back of the eye. That's where the macula is. The macula area is a high density area with rods and cone cells, the cells that are very important for vision. It's also a degenerative process, and this process is called choroidal neovascularization. Big word for just meaning that there's new blood vessels being formed at an excessive rate. What determines this excessive rate of vessel formation is excess content of vascular endothelial growth factor, VEGF. And when this growth factor is high in concentrations, fluids and proteins will leak into the retina. The blood vessel membranes become weak, and that's what causes the leakages. Here is a graphic of a normal eye, dry macular degeneration, and wet AMD. In Karen's case, she has AMD wet. And the graphic is showing the fluid that's leaking into the retinal spaces. The yellow spots are the exudative deposits, the protein deposits. It's affecting Karen's eyesight. Generally, what is the pathophysiology of MD? MD is a degeneration of the retinal epithelium. There are various stressors that are placed on the epithelium. There is less antioxidant content to protect the cells. There's proteins accumulating in the spaces outside the blood vessels. Lipids are leaking out around the retina, and the mitochondria are failing. Karen has a particular type of macular degeneration, diabetic macular degeneration. In diabetic macular degeneration, there's macular edema happening from the increased blood glucose that's increasing the blood vessel permeability. It's making the integrity of the blood vessels less strong. You'll see microaneurysms, microhemorrhages, hard exudates, cell damage, all happening on the eye. There's also inflammatory processes going on with the cytokines and chemokines. Vascular endothelial growth factor is being expressed. And when this is being expressed too much, there's new blood vessels being formed, and treatments are aimed at reducing VEGF. There's also retinal thickening around the macula. Here are some pictures of the normal eye. As you can see, the blood vessel integrity is fine, it's normal. And then in diabetic macular edema, you can see all the exudate patterns, the yellow, and it has a close-up graphic of what's going on with the macular edema on the retina. Here's a real picture of an eye that has macular degeneration, diabetic macular degeneration. The fovea is the area where the macula is. You can see the exudates, and the hemorrhages, and the microaneurysms. So this is what Karen's eye would be showing, something like this. So how is Karen going to have her macular degeneration diagnosed? The doctors are going to use this machine called an optical coherence tomography angiography. And this machine is going to visualize the blood vessels in the back of her eye. So again, the tomography is going to be taking pictures of the eye so the clinician can visualize the eye's vasculature. They'll be looking for new vessel formation and diabetic macular ischemia and microaneurysms. As for future diagnosing, AI will be important, and AI will be used for a type of scan as what facial recognition does. It's a type of facial recognition, but for macular degeneration symptoms. The technology will identify macular degeneration biomarkers and blood vessel abnormalities. They'll be referenced to a central database. The images are compared to evolving database of images. This diagnostic technology will predict disease progression and recommend treatments. It has an over 90% classification activity for wet MD, and deep machine learning is showing high degrees of accuracy. So how is Karen going to get treated? What is her treatment? The most common treatment for macular degeneration is getting these monthly injections of anti-VEGF medications. First, there is a loading dose for the first few months, usually the first 3 months. Then after that, there's a maintenance dose. Maintenance dosing usually happens for life. However, the doctor will be monitoring for progress with the injections. If they're seeing a lower rate of disease progression, then the doctor may be able to make the doses further apart. Maybe there'll be one injection every 3 or 4 months. But Karen's going to be on these injections for the rest of her life. Just the frequency of them may decrease. And what these medications are, they're derived from antibodies of humans and primates, and they disrupt the structural integrity of the VEGF molecules. An emerging treatment is gene therapy. In the gene therapy, they're using viruses as vectors to transduce genetic material for protein encoding of anti-VEGF. So far, these treatments are showing 85% less treatments for over 2 years, and the study subjects are also showing improvements in their vision. Another emerging treatment is stem cells. The stem cells are injected into the retina, and then new retinal cells are generated and replace the injured photoreceptors. Studies are showing improved visual acuity with stem cells. And what is Karen's treatment plan going to be? Other than getting the monthly injections of the anti-VEGF medication, there also need to be some lifestyle modifications. No more smoking, be encouraging a healthy diet with high antioxidant content and vitamin content in her fruits and vegetables. She'll need to be managing her hypertension and her diabetes well. She'll need to maintain a healthy weight and daily exercise. Routine eye exams will be important to stay up to date with where the disease progression is, and vitamin supplements to help with eye health, vitamin C and E, lutein, zinc oxide, and cupric acid. As for coping and support, it will be important for Karen to stay up to date with her eyeglass prescriptions. It's recommended to use magnifiers for reading close up to prevent too much eye strain. And then her digital displays that she uses with her computer and her phones and her alarm clocks and so on, those displays will need to be updated to have larger views and also to add audio where needed. Bright lights will be encouraged to be used in the home, and it's going to be important for Karen to have adequate transportation because as her macular degeneration disease progresses, it's going to be hard for her to drive. So she needs to make sure that she has adequate transportation to get to where she needs to go for her basic living needs. Thank you for watching my presentation. I hope you learned something about macular degeneration, and I look forward to watching all of your presentations too.